This presentation is on information governance, or IG, in the healthcare environment, presented by team members Marshall Gray and Suparna Sharma for the HIM 2820 course at Santa Fe College, spring semester, presented in March of 2017.
Hello everyone, my name is Suparna Sharma and I'm here with my colleague Marshall Gray. Our presentation today is about information governance, or simply IG. According to AHIMA, adopting an information governance program shows a healthcare organization's commitment to manage its information as valued strategic asset. IG serves the dual purpose of optimizing the ability to extract clinical and business value from healthcare information while simultaneously meeting compliance needs and mitigation risk. So let's continue our presentation. Over to Marshall. Thank you.
Thanks, Suparna. While it's widely known that the core mission of the healthcare industry is patient wellness, wellness depends on quality of care, and quality care is dependent on the precise flow of patient data. Data forms the foundation for the collaborative efforts of healthcare organizations to provide the best care possible while maintaining cost-efficient processes and planning for future needs. This data isn't just important, it's critical. It's vital to manage the influx of data streaming through our information systems to meet the ever-changing face of regulatory requirements. Information governance is a relatively new and specific management tool in today's healthcare environment to protect the vast amount of data that moves within the continuum of care, data that must be safeguarded from unintended and often destructive compromise or loss. Fortunately, there are formal guidelines to aid in assessing and implementing an IG program and a well-prepared workforce of professionals who will be mentioning later in the presentation, ready to do the job. Let's get started.
In this presentation, we will be covering what is information governance, why is information governance important, principles of information governance, and why hire an RHIT for your information governance.
So what is information governance? According to Gartner.com's definition, information governance includes the processes, roles, policies, standards, and metrics that ensure the effective and efficient use of information in enabling an organization to achieve its goals. IG is about managing data elements themselves, not their uses or information technology components such as hardware and software. Traditionally, IT experts manage the systems that hold and process information, but they're not responsible for understanding why and how the data they store are meaningful. On the contrary, employees who deal with the facts and figures understand the value of the data they are working with, but rely on the IT workforce and IT systems to store the information. This leaves a gap in which no one is truly placed in charge of the data itself. No one owns the responsibility of the individual management of data bits. Thus, IG seeks to recognize this problem and put someone in charge of the data elements themselves, to establish clarity in information retention and storage practices, and ensure that valid current data is kept while outdated or useless data are not needlessly retained.
According to American Health Information Management Association, AHIMA, information governance ensures that accurate information gets to the right person for the right reason at the right time to make the right decisions.
So why now are we worried about information governance? Because there's an increasing focus on healthcare data and health information technology to drive improved care for patients. And just generally because we're experiencing a rapid adoption of technology of all sorts and a shift specifically from paper-based records to the electronic medical record. As the use of these electronic medical records increases, so does the possibility of exchanging health information across more entities and geographic boundaries. While doing this, it remains important to protect the accuracy, accessibility, integrity, privacy, and security of the health information during these transactions. All of this is possible by adopting IG policies and procedures.
Now we come to the next point, which is why is information governance important? IG process or the information governance processes can help any organization, first, to better utilize their data they collect, and second, to create reliable and complete information critical for achieving their ultimate business goals while meeting regulatory requirements specific to these data management concerns.
Why is information government important? This is a simple diagram that explains why information government affects so many areas of healthcare. It can affect compliance with federal rules and regulations. It can make businesses more efficient and effective in their operations by reducing their costs and reducing their risks, which cost them money. It can improve public health. Information government allows for a better information exchange system, a safer delivery of care, and improved quality of care. The effects in these areas can be felt by physicians, their patients, and the healthcare facilities in a number of ways. For instance, complete and accurate record data from the past can be used to track changes in the health of a patient in real time. On a broader scale, information governance policies that protect data integrity can improve network capability and regulatory compliance. For organizations, this improves business operations and saves them money. And data compiled across different healthcare facilities in different areas of the country can do things like determine better population health policies, create more comprehensive disease and cancer registries, and ensure continuity of care. In turn, these valuable bits of data help clinicians make better evidence-based care decisions, bringing us back again to the issue at the center of healthcare, which is patient wellness.
Now that we have established how important information governance is for your business needs and clinical needs, let's move on to see how you can implement information governance for your practice. AHIMA, AHIMA has given 8 IG principles to be considered when implementing any IG process for your practice. These 8 principles are accountability, transparency, integrity, protection, compliance, availability, retention, and dispositions. Now, the following slides will discuss these principles in details.
The first IG principle, as noted by AHIMA, is accountability. Accountability means that one qualified person at the senior management level should be responsible for implementing and maintaining the IG program, with major goals of establishing identifiable auditing and reporting protocols. Transparency is the second principle. It is defined as open and verifiable documentation where structures, processes, and practices of information governance are apparent, understandable, and reasonably available to legitimately interested parties.
The third principle of information governance is integrity. This refers to the trustworthiness of data, specifically meaning that data be authentic, timely, accurate, and complete. The fourth IG principle is protection. Protection covers the Health Insurance Portability and Accountability Act, which is HIPAA's requirement of privacy, security, and protection of personal healthcare data.
AHIMA's fifth information government principle is compliance. AHIMA recommends that all facilities do whatever they need to do to comply with state and federal laws regarding medical record documentation, storage, retention, and retrieval, as well as appointing a compliance officer in order to meet the requirements of this principle. Next is availability. Availability means making sure that health information data is available to all stakeholders in the continuum of care. The Health Information Exchange Initiative by the Office of National Coordinator also falls under the availability principle, because increasing information availability across organizational, state, and geographic boundaries means increasing access to those who deal in patient care.
The seventh principle of information governance is retention. The retention period is dependent on state and federal guidelines and also on accreditation agencies' requirements, such as those of the Joint Commission. AHIMA recommends that a facility should retain medical records for 10 years from the date of the last visit. The eighth and the last principle is disposition, which means that destruction of inactive records after the required retention period should be conducted in accordance with federal and state rules.
So who can do this job? Considering the numerous responsibilities and data management skills needed for an IG plan to be successful, a highly qualified professional should direct the task. Hiring the right person for the job is the first step in meeting the goals of information governance. So who exactly can do this? The registered health information technician can.
The coursework and training of an RHIT program equips the professionals with the skills essential for managing health information. These skills are health information management, legal knowledge, knowledge of HIPAA for compliance in issues of confidentiality, privacy, and security, process improvement skills, an understanding of data analytics, IT planning and implementation process. Continuing on with RHIT skill set, the next skill they have is the knowledge of EHR and the clinical decision support. They also have skills associated with leadership, collaboration, team engagement, critical thinking, and problem solving. RHITs are also often called the agents of change, which means they have change management capabilities and they also focus on team building. The last but not the least skill is the knowledge of information lifecycle, and they also have ability to manage projects.
Hire an RHIT, of course. Accredited by the Commission on Accreditation for Health Informatics and Information Management Education, or CAHIM, at the associate's degree level. The RHIT professional has been taught to understand the value of data integrity with their training in medical record completeness, accuracy, and proper entry into computer systems. They are also prepared to use the very systems necessary to verify IG goals with training in data analytics and compilation that turns bare data into usable information and then knowledge. Through the use of these skills and further on-the-job experience, the RHIT professional is well prepared to lead the IG effort. In conclusion, providing quality healthcare to patients is the most important objective in any healthcare delivery system. Accurate, accessible, and complete medical record data is a crucial factor in reaching this goal. IG processes will ultimately improve the integrity of medical records, thereby improving patient safety while ensuring legal compliance and helping healthcare organizations be effective and efficient in managing their administrative tasks. Hiring an RHIT professional to lead the effort can be the first step in implementing IG tasks and reaching the overall goals of a healthcare organization. This concludes our presentation on healthcare information governance. For references, we use the article AHIMA, Leading Information Governance for Healthcare, at www.cms.gov. Way Forward, AHIMA develops information governance principles to lead healthcare towards better data management, from the Library of AHIMA at ahima.org. The article AHIMA's 8 Principles of Information Governance, from Becker's Hospital Review at www.beckershospitalreview.com. What is Information Governance? A blog by Deborah Logan. Information from ahima.org for the Registered Health Information Technician. And an article entitled, What is HIE? At www.healthit.gov. On behalf of Suparna Sharma and myself, Marshall Gray, we hope you have enjoyed this presentation.